Friends, let us look at the pre-test counseling for 18 to 22 weeks anomaly scan. When a couple comes to me, I counsel them as to what we are going to do and why and how. I tell my pregnant patient and the couple that the global incidence of uh, a congenital anomaly in the general population is 2.5%. Ultrasonography can detect most of the congenital anomalies, but not all. What are the risk factors for anomaly? Fever, high-grade fever, radiation, and intake of certain drugs during the first trimester, that is 4 to 10 weeks from LMPA especially. Remember, 90% of the congenital anomalies occur in fetuses without risk factors, and therefore this scan is offered to all the pregnant ladies. We do systematic examination for structural anomaly and or presence of any soft marker for chromosomal abnormality. What are the factors which influence detection of anomalies? Why it is not 100% sure? Why we cannot detect 100% of the anomalies at this scan? Friends, it depends on the gestational age at the time of ultrasonography examination. Also, the natural history of the disease during the fetal life, the gestational age at the time a particular structure is going to develop, the man, that means the operator's training, skill and experience, the machine, that means the resolution of the sonography machine on which we are performing the scan, the malformation, whether it is major or minor, whether it is single or multiple anomalies are present, and what is going to be the proper follow-up after birth. All these factors influence the detection of anomalies. So let us see what is the detection rate of different anomalies. An anomaly like anencephaly has almost 100% detection rate in pregnancy sonography. Spina bifida generally is detected on sonography in 90 to 95% of the cases world over. Abdominal wall defects and major kidney problems can be detected in 80 to 90% of the cases. Cleft lip, that means the gap in the lip, is detected in 70 to 80% of the cases. Major heart defects are detected in say 50 to 70% of the cases world over. Some anomalies like congenital diaphragmatic hernia where there is a gap in the diaphragm, also hydrocephalus where is excessive fluid in the fetal head, and severe skeletal dysplasia where there are bones are short, and such type of anomalies can be detected in almost 60% of the cases world over.